we go ahead, and this is what I am going to be talking about. So you look at the image, the heel is in valgus, and you see the arch, and you see the image below, and you can actually see that the patient is able to restore the arch. So you get this kind of patient coming into your OPD, no matter how symptomatic they are. What I am going to convince you is, no matter how many workshops you attend, don't sell surgery to this patient. Okay? This is another example. Bilateral, flexible, flat feet. The patient is standing on the toes, arch is restored, heels are coming into varus. Okay? A younger child, more puffy, more fatty, flat foot. Okay? The heels are getting restored by standing on the toes. And beware that I am not talking about patients like this, whom you just look at the foot because you've just done a workshop on flat feet and you forget to look at the knees. So now let's see some of our patients who come to our OPD. So this child is not yet walking independently, 18 months, okay, and you look as the video comes closer, the parents are really worried about this kind of flat foot. So here you want to know that the patient is having mild motor delay, and you definitely don't want to be operating anything in this patient. This patient requires therapy sessions. Now this is a slightly older kid, as she scampers everywhere, she is a good ambulating child, and you see parents are concerned about predominantly the left-sided flat foot. So we have counseled them, she is on orthotics, walking better, and they have hope of symptoms getting abated with just orthotics and exercise. What else do parents come with? Parents come as curious parents. So this is outgoing, flat foot, flexible. You see the arch getting restored on the left side video, okay? And he doesn't even come down, he stands so well on his toes. He refuses to come down in the video. So these are merely curious parents, and you start offering surgery. अरे मैं अभी एक सर्जरी सीख कर आया हूँ, आर्च रिस्टोर हो जाएगा आपका. But मैं क्यों रिस्टोर करूँ? That is the main thing. What is this parent worried about? अरे whether he's inherited this flat foot from his dad, and which sport should I make him enter? So now this is another girl. Okay, this is an older girl, adolescent girl. You see more on the right side left, less on the left side. Similarly, an out-toed boy, bilateral flexible PES Planus. So these are the kids who are curious. The parents are merely curious कि इसके लिए कुछ कर सकते हैं क्या? लेकिन ये तो 10,000. This patient came to me saying कि अरे ये मेरे साथ 15,000 स्टेप रोज चलता है. तो आप ऑपरेट किस चीज के लिए कर रहे हो? Means will he walk in lesser time? How can you guarantee that? Look at him running. He looks odd, but the parents are satisfied. So are we going to operate these kind of flexible PES Planus? Yes, these you can. So this is an example of peroneal spastic flat foot, okay, painful, without a tarsal coalition. These you may offer surgery. So how do these flat feet present to us? They would be flexible or rigid, as I have shown you. They will come with different types of parents. They will be symptomatic with some pain, with some out-toeing, problems of arch restoration sports. और they would be merely inquisitive कि ये है क्या सर, कुछ abnormal है क्या मेरे बच्चे में, कुछ करना है क्या इसके लिए, and they will be having a body problem or a soul problem. Soul means not the atma, the soul. मतलब they'll be having an extra fat pad in the soul, or they'll be actually having joint related or tibialis posterior related issues, and they'll be coming in all kinds of age group, and we have to wonder कि ये मैं सबको ignore कर दूँ? Can we ignore all the flat feet? Or should I operate all the flat feet? So from the two end of the spectrum, let us try to see from literature कि बीच का रास्ता क्या है. And then we ask us various questions when we begin conserving, starting from the fact that can flexible flat feet be corrected? मतलब हम कोई treatment करके उनको correct कर रहे हैं क्या? And then what is the success rates of conservative treatment? And if I am not conservatively treating them, then what is the longitudinal follow-up of the flexible flat feet whom I am operating upon? So exercise, foot orthosis also, is it a good idea? Does it make us run like the horse I have shown? And is flat foot a fat foot or otherwise? So actually the articles tell that flat foot is not as innocent as it looks. Okay, it's actually a loss of stability and alignment of the talotarsal joint. So it's not merely just an appearance, there's lot happening inside, and you can see that there are a lot of problems which can occur due to flat foot. So that means a symptomatic flat foot has to be treated, but the treatment does not have to be surgical, is what I am trying to tell you. Even the biggest pediatric orthopedic foot surgeon on the planet, Vincent Mosca, also says that 99% of the flexible flat foot will not be treated surgically. So this is a lady doctor with a very symptomatic flat feet, as you will see, okay, almost getting deformed, but fairly good. Other than the cosmetic problem, she does not have any major problem. So most flexible and rigid flat feet do not hurt, okay. And if pain is the presenting complaint, then it's very important to understand from where the pain is coming. Surgery is rarely, if ever, indicated for flexible flat foot. And if the goal of surgery is to change the shape of the foot, then we should not really do the surgery in a flexible flat foot. Let's see some support from literature. So the potential risk of conservatively treating a flat foot is zero. There is some risk that the patients may not get adequate relief, may not have arch restoration, but definitely will not induce any complication by conservatively treating a flat foot. But we can continue debating, but over the last 2000 years, this debate is not yet settled. So I wonder whether Chasnal will be able to draw a conclusion to this 2000-year-old debate. There was a study conducted on flat foot in Indian population, and they found utility in using the CNE heel and the insole. They did find that exercises alone did not help the patient with flat foot. And the studies which are there on conservative treatment of flat foot say that what we can correct is only pain and some disability. We should never promise arch restoration by conservatively treating flat foot. So then there are articles which say that should surgery be done. So let's review those articles, and those surgical articles themselves say that the complication rate is as high as 17.5%. There could be implant extrusion, there can be non-unions, and there can be varying complications of operating upon a flexible flat foot. So one of our biggest cricketer ever alive, Dhoni, is flat-footed. So you can imagine Dhoni has never undergone surgery, he has flexible flat foot, and can there be anybody bigger than Dhoni? So we can always give this example to our patients. Okay, that's an example of my therapist. She is flat-footed, but in a Bharatnatyam pose you can see she can activate her muscles and restore her arch. So let us think, you have a 10-year-old son with a minimally displaced lateral condyle fracture, and you have a 10-year-old son who has flexible flat foot with some pain, some outtoeing and some foot fatigue, and you have debating pediatric orthopedic surgeons. Whose advice will you follow more easily? I am sure it's easier to follow advice for the first one. The lateral condyle, your subconscious mind says, okay, chalo, wire dalwa leta hu. But for flat foot, would you get your own son operated? So after all this bhashanbaji, what do? Okay, this is the message for you. So you diagnose a flat foot correctly, make sure that it's not syndromic and it's purely a flexible flat foot. Counsel parents, follow them up, put them on orthotics. Orthotics help. They help. Okay, they help in relieving pain and they help in relieving outtoeing. They do not restore arches. That is what you have to counsel. So follow up is the biggest friend. So you follow up those patients and never operate. Okay, never operate a flexible flat foot.